Hello everyone, welcome to our Facebook Live handled by Luma Health and Samitivej Hospital. Today we will talk about mental health in the COVID era, concern and issues with children and adolescents. We will handle three main topics. The first one will be an introduction to mental health in Thailand. The second one will be the specificities of child and teens psychiatry. And the third one will be the mental health in the COVID context. So for this event, we are very pleased to welcome Dr. Yossamon Jiratthawong. She's the child and adolescent psychiatrist in Samitivej Srinakarin Hospital. And also Dr. Gerard, our Luma Chief Medical Officer. So to start this Facebook Live, I will ask Dr. Yossamon to present herself first.
Okay. Swadika. Good afternoon, everyone. My name is Dr. Yossamon Jiratthawong. So I work as a child and adolescent psychiatrist at Specificities Srinakarin Hospital. My background is that I did general psychology in Thailand, and then I did child and adolescent psychiatrist in the UK. So my job description here is to take care of the children around like preteens, teens, and maybe late teenage and young adulthood. Yes, nice to meet you.
Nice to meet you.
Okay.
So I take over. Dr. Yossamon, it's really a pleasure and honor to have you here. So, and also welcome to all the audience of this Facebook Live today. So I will have a few questions which will be around mental health among children and teenagers. So maybe we can start by a general question, such as what are the most common mental health problems with children and adolescents you encounter on a daily basis in your practice?
Okay. Well, because as I mentioned that I take care of a wide range of the growth of children, teens, and late teenage or young adulthood. So the most common problem that I need to divide into three groups of children. So the first group is like a very young child, maybe like a school age, before teens. So the most common problem I have in my clinic is that it's involved in developmental. It's about like behavioral problems, for example, like ADHD or any behavior. Yeah. And then on the second group of my patients, teenage, young teenage, mid-teenage, and late teenage. The most common problem is that I found the first one is depression. Yeah, and the second one is anxiety. Yeah, the late group of maybe late teens or the young adulthood. The most common is still the mood disorder. For example, like depression, maybe coexist with anxiety and any other mood problem. For example, like bipolar disorder. So they are different, most common mental disorder in each group of the patients.
All right. Okay. And still, depression, anxiety are the most common symptoms.
Yeah.
So, since we are in the era of COVID-19, and it's a very hot topic nowadays, and people are very concerned, I guess, I'd like to ask you a question with people who have already chronic mental disorders. Did COVID affect them further, or so in which way they were mostly affected by the environment, the stressful environment of COVID?
Yeah, of course, it is undeniable that during this circumstance of COVID-19, it's greatly impact on like the, how can I say, the children or the one who have pre-existing mental health problem. In a way of what? In a way of one, maybe can worsen the symptoms that they had before. And number two, it's the problem about like how they can get through the services. For example, like maybe they need to postpone the appointment because of the lockdown, for example. In a way that it can make them feel, how can I say, like has like worsening symptoms. But in a way, when they have that symptoms, maybe it's an obstacle for them to come to get the services. But we, as per over the past 6 months that we work on this situation in our hospital, so we provide with the tele consultation in some case that we know that how can I say, like some counseling or some guidance or some support that we can give them via tele consultation. So that's the way that we work. But in another aspect that I have found in the clinic is that so some teenagers, so they are affected by the disruption from this situation. So it's a new case after March or April. So they come to me, like I think it's kind of like the great number of teens come to me compared to the over the past like 3 months before COVID.
So these, Dr. Yossamon, these are children who do not have pre-existing mental disorders. So what you mean here, you have an increased number of children, especially adolescents, coming to see you because of the situation of COVID, even though they didn't have any mental health problem before.
Yeah. Yes, exactly it is. Yes.
Another question related to what you were saying, that a hospital try, because of the lockdown, to implement telemedicine, which I think it's a good approach. But what is your experience in telemedicine in terms of the impact of your counseling and the, let's say, the consultation effectiveness when you do a consultation face-to-face in your clinic, in your room, versus what you can get from telemedicine? Is there any difference?
Yeah, there's a lot of difference. So the best thing is that I want to see the patient in person, one-on-one, or like just a real thing, because if they need any, how can I say, if they have like serious symptoms, for example, like suicidal ideation or any other thing like that. So we need to do something like we call like intervention, or we need to do the referral or something like that to get them to like get the proper setting to help them to keep them in safe place. But in the case that we can do for, I would say like teleconsultation wouldn't suit the CV case. And number two, it wouldn't suit the case that needs medication. Because when we have to start the medication, we need to look at like maybe vital sign or any other thing or physical examination, which we were not able to do so via teleconsultation. And number three, in case that you need to like the new case, we cannot do via teleconsultation because we need the first evaluation in person. So we have limitation about we choose the case to do the telemedicine or teleconsultation. So the case would be number one, the old case that we know that they are quite stable, and then we want to follow up how are they, that kinds of thing, and maybe they don't need to adjust the medication, just keep the same dose, and then just only like checking whether they are all right or not. Or number two, the old case that feel like they can't cope at that time, and then they need some help. So the thing that we can do for telemedicine is just like to evaluate whether they need to come into the hospital or not. So it's kind of more like early detection, and then maybe I will give them some advice or suggestions. If they are in like a group of high risk, maybe I will ask them to come to the hospital for the proper management. Just like that.
That's very interesting comments, Dr. Yossamon. We know by experience, by history, that when there is a very serious economic crisis or a health crisis in a country, there are several disciplines which will be affected in medicine. One of them is psychiatry. Because if you really said that for new cases, for instance, somebody who may have some initial pre-existing mental health problem, but minor, did not trigger yet consultation. And then you have this lockdown which happened. And then the consultation may not be possible face-to-face. And as you said, Tele Consultation may not solve this case because the first time you still want to see the person in front of you. So I think this is one of the main drawbacks of implementing lockdown, a serious lockdown. We know also that cardiovascular disease, people who have some problem cannot also attend their normal consultation with cardiologists in the same manner also for people having cancer who need follow-up for chemotherapy, for instance. And that's why in the lockdown process, on the political side, because of course politicians take care of that, they really need to assess benefit risk of implementing measures like this, because it impacts not only, of course, the benefit of lockdown, the hope that there will be less circulation of the virus, so maybe less COVID impacted death.
Yeah.
On the contrary, then you have also many other problems which will happen, especially in psychiatry, cardiology, and also oncology problem. So do you share this opinion?
Well, you mean my experience in the Samitivej setting about
Yes.
like how hard that people can get in through this hospital?
Yes.
Okay. Well, I think during March and I think during late February and March 2020, I think it's kind of in our hospital. I think we are open to the patient to come to follow up. It's not how can I say like, but the thing is in Thailand, people are aware and get worried about the COVID spread in like the hospital area, so they avoid to come to follow up. Even we here are ready to serve that service. I'm pretty, how can I say, like, for physical illness, I talk to other doctors in here. Lots of patient lost follow up, and how can I say, like, it might impact their well-being in terms of medication they need to be on regularly, or the severe case that needs a lot more investigation. So it's make this problem happen. But the thing that we can do at the hospital is maybe sometimes we don't do teleconsultation, but we make a phone call to follow up, and then to say whether okay you have enough medication, anything that happens. So we do like that in the case that still how can I say, like in the hospital, and then all the specialty, the doctor try to follow up them on the phone. So this is the during that kind of lockdown we can do
You keep
as
contact
best
with
as we can.
And luckily in Thailand, the lockdown was not too prolonged. So, and as you said also, there was still the possibility to still go to hospital. Even though I heard Samitivej group, there is minus 20% number, 20% less people coming to visit the hospital during this period, and even worse in some other hospitals. So this is an important concern which politicians need to know also, that the risk of having very serious lockdown process, for instance, have also negative impact on other diseases. One more question is, we are discussing with Alex here, nowadays, how does the Thai society perceive mental illness? Is there any change over the last 5 years or 10 years as compared with before?
Yeah, of course. In my experiences, I've been working in mental health, department of mental health for more than 10 years. But in my opinion, over the past 10 years, Thai people has become more open-minded and then understand more about the mental disorder is a part of a health but it presents in another symptoms, a different symptoms. For example, like emotional symptoms, behavioral symptoms, or thought symptoms. So now they do understand more, even like, okay, so especially the new generation. Because I found that at my clinic, I've been here for more than 8 years. And then the thing is that over the last 5 years, the parents and the teens, I think it's more than, I think, I think the parents seem to open more about how their child's, how can I say, like the concern of their child. Because when I ask the teens that come to see me in the beginning of the session, I always ask that, what is your most concern to come to see me here? Do you want to see me yourself, or parents want you to come to see me? Most of them say like, I want to see a psychiatrist because I think that I have some problem. Some of them tell the parents that, oh, please take me to see a psychiatrist. And then the parents surprised, what happened to you? So, and then the parents allow them to take them to a psychiatrist. More than like maybe like before 5 years, maybe the parents before 5 years, some children, some teens ask for help, but the parents deny, and then they just like dismiss it. And maybe they think like it's a normal teenagers, maybe you ups and downs, and then you can talk. But over the past 5 years, I do think that the parent is more understand about how was it like the mental health look like, and then they let the child and the teen come to see a psychiatrist, and then they are open-minded to listen to our advice, psychoeducated or any other things. So far, I think over the past 10 years, Thai people is educated more about mental problem or mental health disorder.
That's a rather good news, encouraging news, because when the suffering from the mental health can by themselves suggest to go there, because this will be much better motivation to see a doctor than being imposed by the parents to see. And also it's important also for the parents that there is more awareness about this problem. It's not just some blues problem or often minor issues which almost every adolescent can get, but some of them will get something more serious and they need special care, like a visiting psychiatrist. So that is rather encouraging news here in Thailand.
Yeah, that's impressive.
I remember when I first came here about 30 years ago, not in Thailand, but in Asia. I used to work in a pharmaceutical company, and we had antidepressant medicine. And I remember in Indonesia, in particular, but also in the Philippines, people did not talk about depression. And depression was often seen as silent depression. And the symptoms people express was mainly somatic symptoms, like headache, like difficulty in digesting, stomach problem, and so on. Mentioned the mood disorder because it was not very well accepted among the population. So you think Thailand is much better accepted? Is what you confirm?
Yes. Especially, let me tell you about the background in Thailand. I think maybe 20 years or 30 years ago, when people came to see a psychiatrist, it's kind of like a stigma, because people understand that when you come to see a psychiatrist, it means that you have like psychotic episodes, like you see like Virgin Mary or hearing voices, or kind of that things. So that makes society misunderstand about the mental health problem. But over the past 10 years, the prevalence of Thai people, when we look into the mental health problem, we know that the first common disorder is mood disorder or depressive disorder, which could cause suicide in our society. So over the past years, Department of Mental Health or Public Health in Thailand, they raise awareness about like depression or depressive disorder. So I think the gateway for Thai people in the latest generation, like to know more about this kind of disorder or problem, and then they understand more, they are educated, and then as far as I say, like they become more open-minded to come to see a psychiatrist and to be evaluated whether it's only a problem or it's severe until it can cause disorder.
So in line with what you are saying, what would be the advice of, I'm sure there are a lot of parents, young parents listening to us now. What would be your advice to the parents they have also young children, adolescent a lot. What would be your advice for them if they notice something in their kids to seek advice immediately or not to wait or talk to their children? What would be your advice?
Okay, so my advice that so when we have the children or kids or teenagers, if you notice something change, which is absolutely different from their baseline, for example, like emotional problem, it could be boredom, low mood, sadness, irritability, or any form of emotion which is quite last for a long period of time, or even something which is quite different, for example, like behavioral problem in young children. For example, like be more aggressive, lose a lot of lose temper very easily or become like more aggressive just like that, or even if you find your child or your teenager have difficulty sleeping, difficulty eating, or a change in like their functioning, for example like school performance or academic performance or academic decline, just like that. If it happens or lasts for a long period of time, maybe you might need some help to get your child and your teen to be re-evaluated by profession. But the thing that I would advise you before you notice that in this circumstance, I think over the past 6 months, something, okay, the world changed a lot. For example, like from COVID, from school closure because of the lockdowns, and then we know that it caused a disruption of our functioning from the parents and even the child, and it caused a lot of problems. For example, like the child cannot focus well by online instruction. They find it hard to control themselves. It's not exactly the same as they go to school. They cannot socialize with their friends. So it causes a lot of distress and stress as well, or anxiety in the children. The best thing that you can help your child, maybe you just like give them a chance to talk about what frustrates you, what made you upset, what made you sad, or talk about how they're feeling. Or even you can share your feeling with their child about what happens now in our lives. And then once we know ourselves that how we feel and we know the child feels, we can share and we can help each other by keep doing something that we are happy, make it more relaxed, and then spend time all together during this difficult time. That could help you and your family to stay healthy in these circumstances. But if you try to help your child and yourself just like this, and then you still feel that, oh my God, it's too much for me, it's so stressful. So this is the second thing that you need to ask for help from the professional. Okay, so being a psychiatrist, maybe you can go to a psychologist because I have, let me share some experience that sometimes I've got some from external referral from a psychologist, maybe a psychologist like international psychologist, maybe French or maybe like English speaking psychologist. So maybe expat or any international or foreigner in Thailand. So they go to see a psychologist first. And then once the psychologist evaluated and then it's found that, oh, it's too much for me to handle, they're gonna refer the patient to see a psychiatrist later on. So if you find you cannot cope with your stress, maybe you ask for help by going to a psychologist first, or maybe you can come directly to psychiatrist in Thailand, no problem at all.
Thank you for the very important, interesting feedback for all the people who are listening to us. As you said, I agree with you that especially in the let's say international schools, a lot of children will have a tendency for those who face this kind of mental problems to visit a psychologist. There are good psychologists, can be different nationalities, but my knowledge of psychologists is they don't have a proper training in psychiatry and may not be able to recognize serious symptoms of psychosis or more serious things. So in some cases, which is just minor issues which every teen will encounter at this age, but as soon as it becomes more serious, personally I'm more inclined to refer to a specialist of mental disorder who can say, okay, this is simple condition, can be still managed by a psychologist, while this case may need also more serious attention and care. Although you said you can get good referrals or competent psychologists who know their limits about how to manage it. But I'm not too sure that everybody knows their limit also in this field. That's just a comment which I would like to make also here. Although it's not your field, when you discuss with your colleagues who take care of adults in the field of psychiatry, did they also face a higher number of patients visiting them, and those with current psychiatric problems have also more difficulties to manage? Is it the same?
You mean adult, right? Adult?
Yes. Adults,
adult.
Yes.
Okay. Can you repeat your questions again, please?
The question is the issue which you mentioned, which you face with teens and children. Is it the same issues which your colleagues handling adults do face so in the era of COVID?
Yes. Compared to teen and adults, come with I think most of the cases the same problem. One, I think the first two common things that come to see me in the COVID era, even no matter they are adults or no matter we're teenagers, it's anxiety. Maybe they're worried about the thing that they will not know will be ending or uncertainty. Okay, and I think the adult as well, but maybe it's the different trigger. For example, like financial problem, economics problem, or job loss. Yeah. But they come to me in the same, how can I say, like presenting symptoms, like anxiety, mood symptoms. So the same.
I remember I read an article by Professor Ronachai. Probably you know him from Samitivej Hospital. Professor Ronachai. Do you know him?
Ronachai.
One of the
Ronachai. Yes.
Know him? Okay.
Professor at Samitivej Hospital. Yeah.
That's correct. He wrote an article saying that one of the main reasons, it's not the only one, but one of the main reasons of suicide or suicidal act was losing a job in Thailand. When people lose their job and when they see that there is not so much hope, difficulty to just get financial support for themselves or for the family, they may commit suicide. So have you heard currently, because there are a lot of people who are losing their job, more in the 100,000, maybe in millions now. Have you heard about an increase in the suicidal rate in Thailand?
Before I come to the Facebook Live today, I have read through the statistic that they kind of see the rate of the suicide in Thailand. Now it's over the past 10 years, the rate is the same. But I don't know why, but the rate is the same. Not less, not more. But the thing is, yeah, but the cause of the suicide may be different from the past. I think so. During this difficult time. Yeah.
So
This
no
is
increase.
yeah, yeah, no increasing now. So the same rate.
Okay. All right. That's rather good news in a way. Rather good.
Yeah. I try to find information about this, about public health. Oh, but I'm surprised that the rate is the same. Wow.
It's quite surprising. Maybe there is still some hope. At least in Thailand, you had a very, very small number of people who died from COVID, 59 as of today, which means it's 0.8 person for 1 million inhabitants, which was one of the lowest in the world. I think Vietnam is just at 0.4. But when you look at the US, it's over 600, in France, over 500. So in a way, people could feel that the Ministry of Health and of course the government has managed properly the case of COVID here. Very minimal impact on the health crisis. However, when you look at the economic impact, this is huge.
Yeah. Yeah.
According to the Bank of Thailand, I think there will be a decrease by minus 12% of the GDP during the first semester, which is something which never happened in the country. And when you put this in perspective of 59 people who died from COVID, it's totally disproportionate, of course.
Yeah.
But anyway, it's a good news for what you said about suicide, because I read also some articles saying that when there is a serious economic recession, suicidal rate systematically increase. So I hope it's the same here and even in the future when we start to open, and hopefully tourists will be coming, so there will be more business flowing here, and hopefully a lot of people will recover from the situation. Hopefully, yeah.
Yeah, I hope so.
I think we have almost completed the questions. Do you have any additional tips which you would like this time to give, not to the parents, but more to the adolescents? I'm sure there are a lot of adolescents who are listening to you. Some of them have just minor issues, but even minor issues may develop in something more serious. And for those who may have more serious, can you give them some advice also? So this one more for the teenagers.
Okay, for teenager and adolescent. Well, I would like to give some tips about I think the most important thing about how you deal with your emotion, how do you yourself stay healthy in this difficult time. I would like to talk about the first thing that we need to know is, how can I say, know exactly how you feel, or we call self-observation. So once you know that now how you feel, for example, now I'm sad, and you know that you're sad. And then, okay, if I'm sad, how do you help yourself to be better? So we talk about the coping. So once you know how you feel, what your emotion is, and then you tackle down that unpleasant feeling. Let me give you some example. So if you are teenagers who sit down at the corner of the room, and then you feel, today is so blue, I'm feeling down. So sometimes you don't even know what trigger your mood. But the best thing that you can do is, okay, no, I know that I'm down. So I will try to distract myself, not to sit at the corner of the room, get out of the room, find something that you feel that it will make you feel happy. For example, just sip a cold water, or just watch your face, or just eat some chocolate, just to change the behavior. And then just to be kind to yourself, and then you can handle with unpleasant feeling. Or if you help yourself in that way, and then you find it's not working, maybe you can do something else. For example, contact to other people, maybe your friend on phone, online, or anything. But you share your feeling. So you share what make you feel down, and then you may feel better because of as we know that we are humans, so we need socialize or we need like someone to support. So if you can find someone in your family or your friends that kind of supportive you, I think it can help, and then we can help each other. So among teenagers, I do think keep in touch with your friends. Even you cannot see your friends face to face, but you can keep contact. Maybe maybe via technology or your family members. So don't be alone. Don't sad alone. But if you think that is not help, it's not helping at all in the two things that I mentioned. Maybe if you think like, oh my God, I have no way out, I cannot help myself. So the third thing that you can do is ask for help by professional. So just like that.
Excellent. I just recall what you said is full of common sense and excellent advice. Stay healthy.
Yeah.
So get good food and do some exercise, which is very important also.
Yeah.
Yourself. I hope I'm taking away the notes which you said. Try to find a coping mechanism, how you can diagnose your sad feeling and talk about it with some friends, and which can definitely help you and help yourself as well. And very important, don't be alone. And social life, that's very important, because we are told when you go to any TV, social distancing. This, I think it's a bit crazy, because we are social animals. We are like a group of people. We need to be together. I need to be with my good friend Alex here.
Exactly.
Good. Okay, technology can help, but face-to-face talking, distance if you wish, this is so important. And I think your advice are very interesting for the teenagers who are listening to us, and also for the parents who are listening. Also, now they are more aware also of these mental health issues. I think I will finish here. I'd like I will give the floor to Alex for the conclusion.
Yeah.
But I just would like to express my really deep gratitude for this very interesting information you provide to everyone, including myself, including the teenagers, including the parents. And I hope we'll have the immense pleasure to see you again. Thank you, Dr.
Okay. Thank you for having me today.
So I will conclude this Facebook Live with a big thanks to you, Dr. Yossamon, for all the tips, all the advice for the children, adolescents, even parents who can advise their children for different kind of tips. Really, thank you very much. Thanks to our Dr. Gerard, as always.
Welcome.
Our Luma medical officer here, who have always good subjects proposed to our viewers. Thanks to our viewers and all the people who follow. Samitivej, of course. Yeah. Thank you to Samitivej Srinakarin. Thank you.
You're most welcome. You're most welcome.
Thanks to all our viewers, all our followers. Do not hesitate to leave comments, message on the comments sessions. And also do not hesitate to follow us on social media. All social media we are. And hope to see you all soon, more closer than the social distancing. Yeah.
Okay.
Yes.
Goodbye.
So thank you very much, and have a great day.
Yeah.
Okay, you too. Bye bye. สวัสดีค่ะ
สวัสดีครับ
ค่ะ